Oh, why are some parents skeptical?
Todd, one of the keynote speakers today, Dr. Michael Kudak, said the mistrust of vaccines dates back to Victorian times. He added that in recent years, the handling of the COVID vaccine and the internet misinformation has added fuel to the fire. This is the Murray State Paducah campus where health professionals from across the region showed up to learn about a variety of vaccination and immunization topics. Kudak advises parents to do their own research and talk to health professionals to better understand how vaccinations work.
I think this needs to be something that's shared decision-making between families and providers. We have to do a really good job of listening with our patients. You know, we are working with them, not over them. So I really stress that.
At today's event, they distributed these charts that track student vaccinations by county. Let's go ahead and take a closer look at one of the charts. This is the Fulton County chart that sported a nearly perfect immunization compliance assessment. There's a lot of information here, as you can see, and for a look at all the charts provided from West Kentucky, look for this story at WPSD-Local6.com. Todd? The health professionals I spoke to acknowledge skepticism over the vaccines, but encourage parents to research the statistics before making what they say is a very important decision.
Some of the chemicals and things that people have been worried about in the past about being in vaccines are no longer in vaccines.
Purchase District Health Department's Caitlin Krolikowski addressing common concerns in child vaccination.
Vaccines are generally safe, and when we look at our childhood vaccines, we look at our Tdap and our MMR and our Hib and all of that. They decrease those diseases. They make people less sick. They prevent them altogether.
Dr. Michael Kudak, a keynote speaker at the event, says mistrust over vaccines isn't new.
It actually goes back to Victorian times. Jenner, when he did the first vaccine in 1798, had people that didn't think that the vaccine worked or questioned the science.
Kudak says the COVID crisis added to the distrust.
A lot of the vaccine mandates that we saw employees who worked in hospitals had to be vaccinated. There's been a lot of pushback against that, and I think that's spread to vaccines in general.
And a controversial study linking the MMR vaccine to autism.
Andrew Wakefield published a study in the 1980s, and it was fabricated. I mean, he was trying to create a link that was not there.
With kids preparing for the new school year, experts in Kentucky have concerns.
People need to be reminded about measles. One person with measles can get a dozen people sick.
There has been measles cases in the rest of Kentucky. We've had 14 this year. 13 of those were unvaccinated.
Kudak and Krolikowski urge parents to do their own research.
Well, talking to your doctor, I think that's really where you start, and you go from there.
I think this needs to be something that's shared decision-making between families and providers. We have to do a really good job of listening with our patients. You know, we are working with them, not over them. So I really stress that.
The CDC reports a 93% efficacy against measles with one dose of the MMR vaccine and 97% with the full 2 doses. Dr. Kudak says parents can be sure that the MMR vaccine will not cause autism and is incredibly safe. Live in the newsroom, Charlton-Perrin, WPSD, Local 6.